People are worried they're going to mess up their Medicare enrollment and end up with penalties. There are very specific periods of time that you should be enrolling so that you will not get a penalty. I received this question. I will be 65 in September, and I was told to sign up for Medicare in June before my birthday. Is that correct? Yes, that is correct if it is your intention to sign up for Medicare during your initial enrollment period. I'm going to explain what the initial enrollment period is, and I'm going to explain why there also could be an alternative answer to this question. You're first eligible for Medicare based on age when you turn 65. And when you approach your 65th birth month, you have what's called your initial enrollment period, or your IEP. And that period of time is unique to you and your birth month. So it's a 7-month window, and it's the 3 months leading up to your 65th birth month, your birth month, and the 3 months after. So the best way for me to explain this is, let's use this example. The person who put that comment was born in September. Anybody born the 2nd of the month to the end of the month are going to get a 1st of that month start date. If you're born on the 1st of the month, let's say you're born September 1st, you actually get to start Medicare August 1st, but that's a whole nother discussion. So let's look at this. So if you have a September birthday, the 3 months leading up to September, which would be June, July, and August, you can submit an application to Medicare, actually through the Social Security website, and you will get a September 1 start date. Any of those months when you submit. If you wait to submit your application for the month of September, then you're not going to get to start Medicare until October 1st. Then it follows, if you wait to submit the application in November, you're going to get a December 1 start date. And if you wait to enroll in December, you're going to get a January 1 start date. But regardless of which of those 7 months you submit that application, you will be timely in enrolling during your initial enrollment period and not have a penalty. If you're somebody that is trying to time you're starting for Medicare and you didn't want to start in September in this example, and you want a November 1, December 1, or January 1 start date, I will tell you, don't wait till the middle of the month to submit that application. By the way the rules are written, yes, you will get that 1st of the month start date, but who knows how long it's going to take to process. So if you're not doing it in those 3 months leading up to your 65th birth month, I would suggest October 1st, you do it on the 1st of the month if you're trying to time it for a November 1 start date, and etc. So what's the caveat that I mentioned earlier? 2 caveats. First of all, if you happen to be taking Social Security at least 6 months before your 65th birth month, you don't have to take these steps. You're going to be automatically enrolled. So you won't have to do anything in June the way the question was asked here, because that will already be in the works. If you're taking your Social Security 6 months before, but you don't want Part B, you will have to reject it. The other caveat is this. Let's say that you're leading up to your 65th birth month, but you're still working and you have group coverage, and you're not taking your Social Security and you don't want Medicare because you're going to stay on your plan. If you're at a company with 20 or more employees where that insurance is primary to Medicare, then you don't have to do any of this. Not now. You don't have to tell Medicare you're not taking it. You don't have to submit anything. And then later, when you do retire, you'll have what's called a special enrollment period. No penalties when you go that way either.